Okay, all right. Good morning, everyone. I'm Jan Carasm, and welcome to the bi-monthly meeting of the Health Careers Alliance for Southeast Michigan. We have several new members and quite a few guests joining us today, which is just great. There's so much power to be had in employer partnerships, along with a strong resource network. So welcome, everyone. For those of you new to the meeting, I am the Workforce Program Manager for WIN with responsibilities for state initiatives, including the Electric Vehicle Jobs Academy, as well as the MyReach and MyLeap programs. I also am responsible for convening the Health Careers Alliance, which may be my favorite part of my job because I started my career journey as a radiologic technologist. And after 14 years, I transitioned to roles as community college faculty and eventually workforce dean. And after 23 years of community college, I'm now happily with WIN doing the work that inspires me the most, and that's collaborative, innovative workforce development. Workforce Intelligence Network, fondly known as WIN, has a board made up of 10 Southeast Michigan community colleges and seven regional Michigan works agencies in Southeast Michigan. We stand on three pillars: research, engagement, and solutions. And the Health Careers Alliance embraces all three of these pillars. WIN serves only as the host for the Health Careers Alliance. The effort is led by employers for employers. All the rest of us, including WIN, are here to engage, support, and offer resources for our employers. We have a really packed agenda today with updates as well as two really, I think, impactful and useful presentations for employers and providers. One on Michigan's new Tri-Share program, and the other on the first USDOL registered apprenticeship for pre-licensure RN. So let's get right to it with introductions. I have already introduced myself, so now I'd like to know who is out there attending the meeting. So if you could take just a minute and introduce yourself via chat with your name, what organization you're from, and what your role is. For those just logging on, I keep hearing beeps like more people are coming in. We're just using the chat right now to introduce ourselves, our name, our role, and the organization we're from. Okay. Now I'd like to introduce Valerie Jemerson. Valerie serves as both the acting state administrative manager for sector strategies and the healthcare talent development liaison for the state of Michigan. Valerie actually was a founder of this Health Careers Alliance. I've only been with it just a little less than a year, but it is a dual effort between the state of Michigan's Labor and Economic Opportunity Division and, of course, WIN. And so Valerie now is, I'm going to stop sharing. Let's see here if I can figure out how to do that. I'm going to stop sharing and allow Valerie to share a few slides to offer some updates that she has.
All right, thank you. Good morning, everyone. And Jan, thank you. I believe I am sharing now. There should be a MyReach project summary screen that's available for everyone to see. First of all, I just want to express my appreciation for all of the employers that have stayed engaged and involved and see value in working collaboratively and having an opportunity to learn about resources and services that are available through workforce development and give your input and help lead the discussion. As Jan says, that's why we're here, those of us who work in workforce development. So without your voice, we could not have these types of initiatives, and we really appreciate your support. So I want to thank Jan for giving me an opportunity to talk about one of our projects. We are ending our second year of a USDOL, United States Department of Labor funded grant. We operate this grant project under the name, Jan talked about MyReach and MyLeap, and MyReach is the Michigan Rural Enhanced Access to Careers in Healthcare, which is a network of employer-led collaboratives, including the HCA. So this program was funded by the USDOL because they wanted to have a fund set aside to meet the critical shortages of healthcare workers in rural healthcare facilities. And thanks to the work that's been done by our partners, and you'll see that in just a minute, we've been making significant progress over the last 2 years. The USDOL wanted to look at what are those in-demand H-1B healthcare occupations. So these are the occupations that are the focus of the grant. There are some others also as a result of input from grantees. We do have the ability to add additional occupations if they meet the criteria of the USDOL. But these are the critical focus areas. So you see that sterile processing technicians, surgical technicians, medical assistants, certified nursing assistants, these are all some of the occupations that the HCA and other healthcare collaboratives throughout the state have been working on. For the purposes of the grant, these are the areas where we are providing service. It was a $2.5 million grant, so not enough funding to serve the whole state. We are looking at and hope to have additional funding through the state to supplement the work that's being done through MyReach. That's still under leadership review at this point. But these are the partners. You'll see that SIMCA, GST, Michigan Works, and Michigan Works Southeast, both members of the consortium, have been very active partners. This is a look at the key performance metrics that we've accomplished so far. And when we look at these metrics, these are typical standard metrics for USDOL registered apprenticeship programs. They want to look at how many participants are receiving a grant funded service. So how many have you provided with case management? How many have you introduced to training opportunities? And then the next category is how many are you enrolling in training? How many have been completed their training? And of those that have completed training, how many have received credentials? And then the last two categories, very important, are those who are employed and those that were at the time that they entered the program, they were either unemployed or underemployed. So that's who's represented in this category. And then the incumbent worker, those individuals who are in entry-level occupations and have been upskilled through the grant. So as you can see in these areas, we have a significant number of people who have received their credentials and are employed, and we're hoping to move many more into the employed category as we look at the activity over the next 2 years of the grant, all of 23 and all of 24. The last thing I'd like to mention that as part of our grant commitments, we do have two MyReach Council meetings every year in January and July to update statewide stakeholders, professional associations, and other partners at the Michigan Department of Health and Human Services on the progress of the grant program. That's going to be held January 12th from 2 to 3, and you're certainly welcome to attend. At that meeting, each of the four grant recipients will be sharing updates on their program, including information on other collaboratives related to the MyReach program. That concludes my updates, and thank you. And if anyone has any questions, I'd be happy to answer them. Thank you.
Thank you, Valerie. Sorry, I muted myself.
That's okay. Thank you.
Questions and comments can be directed to Valerie through this email address. Hopefully everybody can see the screen that says email Leo, correct? Yes?
Correct, Jan. Yep.
Okay, thank you. Thank you.
Yep. No problem.
Valerie and I had to do that last minute kind of organization of switching sharing, and so I wanted to make sure that mine is back up. So good.
That's okay. Jan, we do have sorry to interrupt. We do have a comment in the chat from Kay for Valerie. Valerie, how do we get information on joining the January meeting?
Yes, I will make sure that Jan gets the meeting link and she can send that to you. If you'd like me to send that directly, please share your email address. Thank you.
Okay, thank you. Okay, now I'm going to provide some update on the activities since our October meeting, along with a couple of reminders. I spoke in October of the US DOL Nursing Expansion Grant opportunity, and at the time, I thought it would fit really well with the Health Careers Alliance activities that we already have underway, and it would. However, after a deeper dive with the request for proposals, I started to have some second thoughts. It is apparent that the grant is prioritizing the faculty development focus versus the nursing career pathway focus, which is what our proposal would have been centered around. But even more discouraging was the 20% match that was required to, to be a successful awardee of the grant. Also, the maximum we would have likely received is between 1 and 3 million. And for the time and effort that is required with a US DOL grant and the number of partners that WIN has, our return on investment was pretty questionable. When it comes to time and effort of pursuing and then managing a grant, WIN's threshold is really about 5 million and higher. However, in keeping with WIN procedures, we convened a meeting of our board members. And beyond that, I invited the health and science deans from all of our community colleges as well. And it was decided by the board not to pursue the grant. However, the work is not going to stop. We will continue to pursue the work that we're doing and that we have been doing with career pathways, regardless of the decision. So the decision of not to pursue the grant was really of no consequence to the Health Careers Alliance. The Apprenticeship Building America grant was awarded to win, and that will help fund the Health Careers Alliance and its work on establishing apprenticeships, pre-apprenticeships, and supporting employers with intermediary services or training new intermediaries. This will be more relevant later in the meeting as you learn more about the new RN apprenticeship program as a workforce development strategy. In previous meetings, I've mentioned the promising K-12 immersion program led by Western Michigan University Stryker School of Medicine in Southeast Michigan. The program is intended to provide, the way I describe it, as intrusive opportunity for underserved children in the Kalamazoo and Battle Creek school districts, starting in elementary school, and then embracing these kids through their primary education experience and into training for their chosen health occupation from the full scope of health career opportunities from nurse aide to physician and the whole gamut of other healthcare opportunities, job opportunities. Because there is interest from the state of Michigan in replicating this model and from the Health Career Alliance employers, especially those in the medical assistant employer group, they have specifically voiced a need for an intentional career awareness campaign, and this K-12 immersion program can help advance career awareness by all means. So I've been attempting to convene a team, but I need a medical school to lead it. And so I've been targeting Wayne State. And very recently, I've made some headway with Dr. Philip Levy from Wayne State Medical School. He's been serving as my connection to his colleagues for this purpose. So I think that I'll probably be having another meeting with Wayne State to determine what other partners that we bring to the table to kind of explore the feasibility of this program for Southeast Michigan. I've also included the state of Michigan as well as Detroit Mayor's Office and some others to help along with this, but the partnership will expand greatly. At some point, I likely will have the Western Michigan University Stryker School of Medicine team do a presentation to the Health Careers Alliance, as well as this team that will be looking at replicating their model for Southeast Michigan. And so there's a lot more to come on that. As far as the surgical technology program, I've talked quite a bit about this. One of the great things that has happened from the Health Careers Alliance is a group of employers organized themselves and asked me to work with them in developing a collaborative cohort-based apprenticeship, registered apprenticeship in surgical technology. And so I believe it was about 6 or 7 employers that have been meeting, started meeting in mid-July and met weekly through August, at which time then we brought the community colleges, the WIN community colleges to the table, 6 of which have surgical technology programs. And so where we are now is I have been meeting individually with the community colleges that have existing programs, looking at their ideas and their concerns and their questions on how do we bring these 6 existing programs together to provide the related trade instruction, which is a USDOL term, but provide a collaborative cohort-based program for these employers and their collective registered apprenticeship programs. So the ball is in my court on this. I'm still meeting with the with the colleges, but after the first of the year, I'll be bringing the employer group back together to update them. And then we will continue to move forward with our WIN community colleges. I also have talked a little bit about a collaborative LPN program. And just to remind you, there is a group of community college health science deans that are undergoing discovery on the feasibility of establishing a collaborative LPN program to be offered through the EPIC Consortium for statewide access. The demand for LPNs is again prominent. The data shows that it's in the top 5 posted jobs in healthcare for Southeast Michigan. The program would be designed for the incumbent worker as a registered apprenticeship. It would pursue ACEN accreditation, State Board of Nursing approval, and designed in such a way that it transitions to ADN programs or associate degree nursing programs. Several state nursing education leaders are involved in this exploration. A couple more nursing leaders at our community colleges have requested to be part of this conversation. And so again, after the first of the year, there will be a series of meetings of this group of nursing educators, some of which are accreditation peer reviewers, some of which serve on the State Board of Nursing. But we will continue these discussions to look at the feasibility to do it. It's not meant to be in lieu of any LPN programs that still exist. And I say still exist because, there for a while, LPNs were hired often, frequently, were definitely part of a hospital staff. That has kind of changed over the years, but now LPNs, again, like I said, they're in demand. And so when there was a decline in the need for LPNs, many community colleges closed their LPN programs. And so it's not as easy as you think to just open another LPN program, and now it has to be accredited by the National ACEN accreditation process. And so we're looking at this collaborative program as to meet a lot of different needs. One, so that community colleges could use this program to meet the needs of their employers if they don't have an accredited LPN program, or designed in such a way that, again, it serves as a pathway for a nurse aide or medical assistant to then be an LPN apprentice to get the LPN state licensure, and then, if they so choose, and if there is a need, do an apprenticeship from LPN to RN. So that work continues on. Let's see here. Okay, and the next thing, yeah, RN apprenticeship. I'm going to talk a lot about that at the end of the meeting, or towards the end of the meeting. But, I know a lot of you are here for that purpose. So I'm going to breeze through these next few so that there's plenty of time for discussion about the RN apprenticeship program. So nurse aide training changes. Again, I've talked a lot about this. I've had people come and present on this. There's been a lot of positive change in nurse aide training by the state of Michigan. So Laura worked with a slew of educators and employers to really update what the training should be for nurse aides and how they are utilized today. There's been some highly publicized and highly attended webinars. So again, if any of you missed out on any of that and feel like you're in the dark about it, please send me an email and I'll connect you with the right people so that if you do employ nurse aides or educate nurse aides, that we can get you connected with the right people. Pre-apprenticeship programs in healthcare. Again, the K-12 immersion program that I spoke about, I could see that a pre-apprenticeship program in, you know, at the 11th, 12th grade point of a student's pathway into health careers might be a good option to have a pre-apprenticeship program that would take them right into an apprenticeship in a healthcare occupation. So looking at pre-apprenticeship programs and again, how we can embed it in the K-12 immersion program, but how they're being utilized by other organizations and how the HCA can support that. You know, a pre-apprenticeship program is really a step beyond career awareness. It provides enhanced preparation for success in a registered apprenticeship program. So again, it's something that I think we should take note of from the industries of skilled trades and manufacturing, because they do that well. And I know that there are some out there in healthcare, but I would like this group, including myself, to learn more about them. Lastly, we also always offer an update on the EPIC Consortium, because EPIC is such a valued resource for employers and for colleges and for Michigan Works agencies. So first of all, there's some changes in the EPIC Consortium that I've mentioned before. Instead of being under the Michigan Community College Association Center for Collaborative Programs, it is launching out as its own 503C, hopefully as of July 1st. Its new name will be Michigan Workforce Training and Education Collaborative. That's the umbrella name, taking the place of the MCCA Center for Collaborative Programs. It's still led by Dr. Amy Lee. She's the executive dean of the Michigan Workforce Training and Education Collaborative. The reason for it launching off on its own is because there is a high demand for collaboration, and so a new governing board has been formed, and so that the programs are workforce demand driven, and serving as an education and training resource repository, again, for employers, for training providers, and also for Michigan Works agencies. There will be advisory boards. And it would also is a great tool for rapid response to employer demand, but also rapid response for community colleges and training providers who are trying to meet an employer's demand but don't have the program. Currently, the collaborative training programs in healthcare are CT, MRI, EEG or neurodiagnostic technology, sterile processing, surgical technology. Some of these, all of them could, but some of them are currently serving as the related trade instruction within a registered apprenticeship program for employers around the state. Some of the programs that are in development are cardiovascular interventional technologists. Those are the people that work in the cardiac cath lab, but they also work in so many other areas as well. Also in development is lactation specialist, physical therapist assistant, medical assistant. Medical assistant has been one of the programs, but it's being redeveloped again according to employer needs, employer demand. Anesthesia tech and radiography. In discussion, again, I talked about the LPN program for incumbent workers as a registered apprenticeship. Also looking at sterile processing as a standalone training program. Of course, nurse aid, community mental health workers, sonography, and several others. These are all in discussion because of what we're hearing from employers, as well as the ones that are in development and are available are all a result of employer ask and need. The person to call if you're an employer and have need for this kind of any of this training, the person to call is Amy Lee, and what she can do is then connect you with your training provider, your Michigan Works agency, to get the ball rolling for you. Same is true for community colleges. If you need one of these programs or want to add one of your programs to the collaborative model, Amy is the person. And Michigan Works Agency too. If you have a training need, and you can call Amy, whether whether your need is included in any of those that I listed on the slide or not. If you have a need, Amy would be a good person to reach out to, because again, she might be able to help you and bring other partners in to get the training program established that will address your need. Okay, so Amy Lee, before I move on, are you on the call?
I'm here.
Okay, do you have anything to add to what I said?
No, I think you were pretty spot on, Jan. We're really excited for the transition. Our board, we're calling it a transitional board as we're exiting out of the MCCA. We met just earlier this week, and our bylaws are in, and we've already sent for our articles of incorporation. So we're pretty excited about the transition. And we're here to help. So if you have any questions for me, always feel free to reach out.
Okay, thank you, Amy.
Hey, Jan, we have a comment in the chat about please let us know if you need an employer support letter for any of those grant applications that you mentioned.
Oh, great. Thank you so much. You're ahead of us.
Mm-hmm. Love that.
Great. Thank you. Okay, so now we're going to welcome our guest speaker, Cheryl Bergman. She's the Executive Director of Michigan's Women's Commission. So Cheryl was selected by Governor Whitmer as the Executive Director of the Michigan Women's Commission in October of 2019 because of their shared understanding that when women in Michigan thrive, all Michiganders thrive. Can I get an amen to that? Before her work with the Michigan Women's Commission, Cheryl was dedicated to ensuring that women were elected to leadership roles at both the state and federal level. Cheryl helped ensure the successful candidacy of Senator Debbie Stabenow as Michigan's first female U.S. Senator and Jennifer Granholm, Michigan's first female governor. Most recently, Cheryl served as senior advisor to Governor Whitmer's 2018 campaign. Welcome, Cheryl. We're excited to hear about the TriShare program. So I'm going to hand it off to you and allow you to share your slides.
Wonderful. Thank you, everyone. Thanks for having me and for allowing me to share about TriShare. So I'll go ahead and share my screen here.
Okay,
So,
are you
can you see it? Oh, you probably can't see it yet. Hold on. Sorry. I'd have to share first. Hold on. Sorry. Here we go. Here we go. Can you see them now?
Yes.
Okay, great. So my TriShare childcare program, it is now a program, began as a pilot, was created to remove barriers to employment by increasing access to affordable childcare for Michigan families. And it is, as far as we know, it is an innovative first public-private partnership, first of its kind in the country. And in fact, I talked to states all over the place who have heard about TriShare and are interested in implementing a program like it. So we've talked to many states around the country. The idea of TriShare, it shares the cost of childcare among the employers, the employees, and the state of Michigan equally. So each pay a third of childcare. Obviously, it helps eliminate barriers to employment. This program has bipartisan support, so not only the governor, but the Republicans in the legislature as well. And I'll tell you how the Women's Commission ended up administering the pilot, and now we're administering the program, is because in late 2019, when I started this position as the director of the Michigan Women's Commission, Governor Whitmer said, let's go talk to the women in the state and see what their priorities are so we can set our goals and our initiatives for the Women's Commission. So we took off in late 2019 and early 2020 and talked to women all around the state. Everywhere we went, didn't matter, Traverse City, Detroit, Grand Rapids, Flint, everywhere we went, it was all economic security issues at the top of their list. And at the very top of the list, everywhere we went, was the access to affordable, accessible childcare. They all said this is the biggest barrier to employment for them. So also, we are still at, since February 2020, well, back up. So we identified childcare, affordable, accessible childcare, as critical for women in Michigan to fully participate in the workforce. And that was before the pandemic hit. Now, there's nothing at all good about the pandemic. However, it did get our policymakers and our employer community, our business community, talking about childcare as an economic driver and not just as a family decision. So out of that was born the idea of TriShare. And this idea had been kicked around a bit. It started with the Grand Rapids Chamber of Commerce on the west side, and this was before the pandemic, a couple of years before, and Small Business Association of Michigan, some other employers and public partners on the west side of the state, because they were already seeing that they were having trouble recruiting and retaining talent, and they knew that childcare was a big part of the issue. So they started thinking about this idea. Then the pandemic hit, and then a champion in the legislature, Representative Van Workum, introduced the legislation to start the pilot. And just to give you a little background on where we are right now with women in Michigan, we're still at nearly 160,000 women who've left the workforce entirely since February 2020. So there's 160,000 women that we have not recovered into our workforce, and at this time. And we can point to childcare. It's not the only reason, but we can point to childcare being one of the largest reasons why women just did not return to the workforce. And women with children 13 and younger are still not at pre-pandemic employment levels equal to men in the state. So we started in March of 2021. The legislature, we launched with $1.1 million of state general funds to pilot 3 regions in the state covering 18 counties. And these original 3 regions were Northwest Lower Peninsula, the West Shoreline there you can see, and then the Great Lakes Bay region. In October of 2021, and then the Kellogg Foundation funded 2 regions in Southeast Michigan, one in Detroit and one in Battle Creek, which is one of their service regions. And then in December of 21, the Balmer Group funded 2 regions in Southeast Michigan, one in Detroit and also Wayne County. February 2022, for FY 2022, the legislature granted another $2.5 million to expand the pilot, and we added 7 regions. In July of 2022, so this for FY 23, the legislature allocated another 2.5 million for the program and made the funding ongoing. So we're moving from pilot stage to program now. And we're currently serving 59 counties of our 83 counties and the city of Detroit. So as you can imagine, there are great benefits to employers, and we are finding with the employers that are participating, they are really having great success in retention and are starting to see offering this benefit of TriShare to employees is as a recruitment tool as well. It obviously removes a significant barrier to employment and helps develop and strengthen that talent pipeline. And I'll tell you, this is changing lives and for families and really helping our employers who are enrolled. I'll give you one example. A woman named Melissa was working for 12 years with a mid-sized manufacturer and kept getting promoted, loved her job. I think it's a family owned, I'm not sure, but I think it's a family owned mid-sized manufacturer. And then she became a single mom recently. And she told her employer her childcare was over $800 a month. And she was struggling to put gas in her car to get to work, to pay for her utilities. And she told her employer, I'm going to have to leave. And figure something else out because I can't keep this up. My childcare is more than my mortgage. And the employer heard about TriShare, enrolled. She is now paying $200 a month for her childcare, remained in her job that she loved. The employer retained a loyal and talented employee, and this is how this program is working. This is just another quote from one of our employers, Vantage Plastics in the Great Lakes Bay region. They are having great success. They were having huge turnover issues before enrolling in TriShare and offering TriShare to their employees. They're also a manufacturer, and the retention rate has just been fantastic. They're retaining employees. Obviously, there are benefits to the working parents. I got to tell you, 30 years ago, when I was paying for childcare, this would have been a game changer for me. And it is changing lives for families. So obviously, it greatly reduces their out-of-pocket cost for childcare. It alleviates the burden of finding available openings of high-quality childcare. It improves their family work-life balance. It removes barrier to maintaining and seeking employment. That 80 families, that's a old number. I'll give you the new number in a moment. But for example, talking about the quality of childcare that has improved for some of these families. There were a couple of families who during the summer had no childcare. So they said, we hired our neighbor kids to basically watch our children watch TV. And now, this past summer, they were able to enroll their children in a quality childcare structured program that helps these kids continue to learn throughout the summer and also gives the parents, just a relief, while they're working, they know their kids are in a structured learning environment, and that feels really good to them. And then there's a family in Traverse City who they were living in their parents' basement. They were a military family, and they had just gotten out of the military, I think the husband. And because of their savings through TriShare on childcare, they were able to afford a down payment for their first home. So this is how it's working for families in Michigan. This is just a quote from a woman who's enrolled, but before she enrolled, $1,200 and $1,500 a month for childcare, and obviously now she's only paying a third of that. Our childcare providers who participate are really happy. So far, so good with participating in TriShare. They're getting reliable, regular payments. And we also, TriShare also assists them in marketing their programs and helping to assist placing families into their childcare. And engagement in this pilot helps to improve and expand future funding for childcare. So I'll give you a little one-on-one on how this works administratively. We have, as I mentioned, 13 hubs. We call them facilitator hubs, who are serving the 59 counties in the city of Detroit. The facilitator hubs are responsible for recruiting employers in their regions to participate, to assist the employees, or excuse me, assist the employers with recruiting eligible employees and determining enrolling the employees, etc. They help the employees find licensed childcare that must be licensed by the state to participate in TRISHARE. And they collect the payments from the employers, the employees in the state of Michigan, and pay the provider on a regular basis. We currently have 107 employers signed on. It's really a very diverse group of employers. We have small and large businesses, medium businesses, a variety of industries from manufacturing, agriculture, healthcare, civil and social organizations. And we just, Kalamazoo, our hub in Kalamazoo, just signed on our first hospital system, which is Bronson. We are currently serving 266 children in the program are receiving childcare. And that is my basic presentation. And I can stop there and take any questions if you would like.
So Cheryl, this prompted quite a few questions in the chat from
Sure.
employers. So I'm just
Yes.
going to start and give
Let's
those
go.
to you. This is from Rachel from the Michigan Primary Care Association. Will this program be made available statewide? We have a few federally qualified health centers participating and seeing success, but other centers are not currently eligible due to their geographic locations and lack of hubs.
Yeah. Yep. The answer is, I sure hope so. And we are currently in the process, like I said, of moving from a pilot to a full program and developing our goals for the future. And one of those goals is to make this program statewide. It may not happen until FY24, more than likely, which would be about this time next year. But stay tuned, and that is definitely one of our goals, to have this operate statewide.
Okay. Another question is, how are you managing if there is a shortage of licensed childcare in a geographic area?
Yeah, and that has been an issue. As we know, it's not just affordability of childcare, it's accessibility of childcare that is an issue. And especially in some of our rural communities in the state, we have had instances where an employer is enrolled, employees are enrolled, and they haven't been able to find an open childcare slot. The governor is working on the other side of this to increase the number of childcare providers. So she introduced earlier this year, Caring for My Future, which is a $1.4 billion program to increase the number of providers in the state of Michigan by 1,000 in 2024. So that goes hand in hand with this program and just our solving for our childcare issue in Michigan overall. We need more providers. There's all kinds of, I heard you talking a little bit about your apprenticeship programs for healthcare. There are also apprenticeship programs now for childcare workers, and also helps them to get into maybe community college and get a degree and a certificate in early childhood so that they can continue their career. So there's all kinds of creative things to help recruit. We don't pay our childcare workers enough, so that's part of the problem. So there are creative ideas floating around about how to solve for that, and also to recruit more childcare workers. And our Licensing and Regulations Bureau, LARA, are doing great work in recruiting more entrepreneurs who want to create and more in open facilities. And there's all kinds of grants like through this Caring for My Future to help entrepreneurs start. And just another fact about women and in this industry, 85% of our child care providers in Michigan are businesses, small businesses are owned by women, and 40% of those are owned by women of color.
Okay. Is there an income requirement for the employee to qualify for the help?
There is. It is the intention of the program was to help the what we call the ALICE population, or ALICE, asset limited income constrained employed. So it is those families who make too much to qualify for the state child care subsidy program, but still struggle to pay for child care. So right now it is at 250% of the federal poverty level to 325% of the federal poverty level. And for a family of 4, that's about $90,000 a year.
Okay.
And we base it on household income at this point in time. Again, as we're working out of a pilot into a program, the eligibility are some things that we're looking at. Do we increase the eligibility, etc.
Okay. Is this program available to fathers as well?
Of course, yes. And as a matter of fact, I've got a really good story. This a father who enrolled in the TriShare program with his employer. I think he had like a 4 or 5-year-old, and when he told his 4 or 5-year-old that they were going to get to go to pre-K 5 days a week, the child, he said, it brought me to tears because my child was just so excited because like their friends went there and they were so excited. So yes, fathers as well.
Okay, there are a couple questions about where the hubs are. So there is a website that lists true where the hubs are. I think Kay Balser provided that link
Right.
in the chat
Thank you.
to find out where the different hubs are.
Yes.
Also, let's see, another comment is again from Rachel, Michigan Primary Care. We have health centers exploring opening their own child care centers for employees. There are also centers participating in TriShare. It's mainly rural centers and driven by lack of accessible infant care. So yeah, I've been in workforce development for a lot of years, like many of you have, and the biggest challenges that we just haven't been able to overcome is childcare and transportation as barriers. So I was so excited. I actually heard about TriShare through the commercials on TV the first time. So.
Oh, that's great. It's working. We launched a paid marketing campaign in August.
Yeah.
And because one of the things our hubs told us they needed was help reaching out to their employers. There's only so much knocking on doors that they can do. So we did launch that. So that's great news.
Yeah, so I did see it and I thought, TriShare, what's that about? It kind of piqued my attention.
I love the tag. The tagline is the employees you need. How does it go? I can't remember now. I'm blanking. I'm sorry.
Yeah. Okay, another question. Are there any special requirements outside of the state licensing requirements that a child care provider must meet to be a hub?
No.
Okay.
Any licensed child care provider may participate in TriShare, whether it's in-home or a child care center.
Okay, great. Anybody else have any questions for Cheryl? That's all of them that were listed in the chat. We know, we can always contact Cheryl through an email if we have more questions or have her come back. But thank you very, very much for informing us today. It's exciting that the state has developed such a program. It really is.
And I would like to, Dr. Tamara Gaines is working with, many of you know her, if not all of you, is working with me on from the workforce development piece of this program and helping recruit employers, etc. And she just put the tagline in the chat: the employees you need this. TriShare.
All right. Oh, we have one more question. Are there any pilot initiatives to support college students with their childcare expenses as they pursue degrees and or certificates?
There is one. So if anyone is familiar with the Reconnect program that the governor started, so that is free tuition for adults. And the legislature did pass some funds to help those students who are participating in Reconnect for expenses, whether it's childcare, transportation, books, etc. At the state level, I don't know of any, and we'll have to look at this, and maybe Tamara knows of something, but I don't know of any other program from the state that affords wraparound services for students for childcare.
What I can say is if that certificate or degree program is a USDOL registered apprenticeship, there are support service funding for things like childcare, transportation to help students while they're pursuing their certificate or degree. And, you know, it's not just USDOL apprenticeships, but MyReach, MyLeap are both examples of programs with support services that help with childcare costs while students are pursuing their educational goals. So, yeah.
Yeah, I think it's something necessary. Students could participate in TriShare as well. If well, for example, Northern Michigan University is one of the employers participating in the Upper Peninsula, and I understand that students may enroll in TriShare as well. Students of Northern Michigan University.
Okay, well, thank you again, Cheryl. This was
Sure.
great information, really promising, very hopeful. So thank you.
Yeah, thank you. Thanks for the opportunity.
Uh-huh.
Bye.
Okay, now I'm going to share my screen again, and hopefully you're going to see, let's see here. Let me get my other screen up that I need. Hopefully you're going to see the one that says RN registered apprenticeship, correct? Yes?
Correct.
Okay, great. So I'm very proud of this. I'm very proud to have been part of the team that brought the first USDOL registered apprenticeship for pre-licensure RN to fruition. So it's an honor for me to share the program with all of you. Oops, just minimized something here. To share the program with all of you in hopes that other employers will embed the USDOL registered apprenticeship as a workforce development strategy to address the need for RNs in our state. You know, in the big scheme of things, apprenticeships are pretty new to the healthcare industry, and there are many misunderstandings, misinformation, and just plain myths within the healthcare industry when it comes to USDOL registered apprenticeship, when in fact, registered apprenticeships are easy. There's a lot of funding to be had and a high return on investment. It's also a means to tap into populations of people who historically have not been able to pursue a nursing education program because of work and family obligations. We likely all know someone who has a college degree and is working a full-time job, not in their field of study because the field that they chose is not conducive to labor market needs. They're working at, say, a Menards or a Starbucks to pay off their student debt and to support their basic needs, rent, utilities, transportation, healthcare insurance, and the like. And yet the idea of going back to school in a nursing program is just out of reach for those people. But because of the way that typically the way that the nursing programs need to be structured. So the intention of this presentation is not only to share and celebrate the first USDOL registered apprenticeship and pre-licensure RN, but hopefully to dispel some of the misunderstandings, misinformation, and myths so that healthcare employers can fully embrace the apprenticeship model as a proven best practice strategy, just as the manufacturing and skilled trades industries have done for decades. So here's the definition of an apprenticeship according to the USDOL. Apprenticeship combines paid on-the-job training with classroom instruction to prepare workers for highly skilled careers. Also from the USDOL, here are what they say the benefits to creating an apprenticeship program is. And I'll touch on, I think, most all of these through the presentations, but gain highly skilled employees, attract new talent pools, reduce turnover costs, increase productivity, create a diverse workforce, and gain a steady talent pipeline. So a couple of things that are important to understand is that a registered apprenticeship program requires a partnership. And the required partners of a USDOL registered apprenticeship is an employer and the U.S. Department of Labor, as well as then the apprentices. That's actually a third one. But the employer and the U.S. Department of Labor together develop a covenant, if you will, of a program, and they sign on. So you cannot have an apprenticeship without an employer, and you cannot have an apprenticeship program without the U.S. Department of Labor. And I use the analogy of a wedding. The employer in the Department of Labor are the bride and groom, and all the rest of us that help to support this registered apprenticeship are the bridesmaids. So education and training providers, Michigan Works agencies, we are supportive resources for this covenant between an employer and the USDOL. And I say these are optional partners. And the reason is because an employer can be their own training provider if they so choose in an apprenticeship, and they can hold their own standards and they can fund the whole thing. So that's why I say that Michigan Works agencies, training providers, and others are really optional ancillary partners because an employer can do it all if they choose to. An apprenticeship program has two parts to it. The first one is the on-the-job training, and that is paid employment. It is for a competency-based program, which healthcare programs are. There is a minimum of 2,000 hours of on-the-job training hours that must be included, equating to 1 year. The outcomes of the on-the-job training is employer-driven. There must be an employer mentor or somebody that oversees that apprentice to make sure those outcomes are being met. And yes, it has to be paid. It does require wages. The other part of an apprenticeship program is what's referred to as related trade or technical instruction. You'll hear it called RTI. That's the school part. And in healthcare, that would include classroom, lab, and clinical education. One of the misunderstandings about healthcare apprenticeships that I have heard is that if it's an apprenticeship, then the training provider just gives up the clinical education part of the program to the employer to be included in the on-the-job training, and that's not accurate. If with the nursing, using nursing program as an example, with the nursing program, there is classroom or didactic learning activities, there are lab learning activities, and there are clinical learning activities. All of that is the domain of the training provider, part of the program for the student or apprentice to be able to successfully complete the educational program so that they can take the state licensure and become a registered nurse. So the clinical education is not replaced by on-the-job training. When a student is engaged in clinical education, they are the domain of the college, responsibility, and when they are in employment hours, on-the-job training hours, they are the domain and responsibility of the employer. So OJT is not in lieu of any part of a training program. So here these are common USDOL terms that you'll probably hear me say, but on-the-job training, OJT, plus related trade instruction, or RTI, equals a U.S. Department of Labor Registered Apprenticeship Program, or RAP. You heard me talk about intermediary. There are many employers that don't have the capacity to manage their own apprenticeships. When you have a registered apprenticeship with the USDOL, there's paperwork, there's tracking, there's entering progress into the USDOL Rapids system to track the apprentices. There's some time and effort involved. I would say administrative time and effort involved. So an employer can do that, as I said, or they can designate what's called an intermediary to do that work on their behalf. So again, the intermediary serves at the request and on behalf of an employer or group of employers. It's free for the most part. There are some organizations out there that are making a business of this and charging a fee, but there are a lot of intermediaries too that there is no cost. For instance, WIN is an intermediary, but so are many Michigan Works agencies and more trying to become an intermediary as a means to be yet another service to employers. So they are responsible for all that paperwork I mentioned, which is called the standards document and all the appendices, sorry. They serve the employer as the liaison between the USDOL, the training program, and the on-the-job training to address any barriers to ensure that the program is successful. If it's a Michigan Works agency, they also are really skilled in braiding the various funding sources, not only the funding sources that they oversee at Michigan Works agencies, but also with the training provider funding as well. And when I say training providers, I'm talking specifically about colleges. Because there's federal financial aid, there's Michigan New Jobs Training Program, there's my Reconnect, there's scholarships, there's all kinds of funding sources that community colleges and universities have as well that can be braided along with the funding sources that Michigan Works agencies have. So again, WIN is an intermediary. Michigan Works agencies are intermediaries, and Michigan Works agencies also manage a lot of funding that helps support the apprentices, not only with tuition and fees of their educational program, but with wraparound services. And it's free. We had an employer in an employer group that I was facilitating. One employer was explaining apprenticeship to a group of other employers, and finally said, it's kind of like, do you want to clean your own house, or do you want to have somebody else clean it for free? And I think that was a spot on example of intermediary. So again, the intermediary tracks and reports all of the required information by the USDOL into what's called the Registered Apprenticeship Partners Information Database System, which is the RAPID system. So how does an apprenticeship work? Well, an employer designs it. Usually they design it in collaboration with a team, and that team is usually they identify a training provider or a group of training providers, and also an intermediary if they so choose to have an intermediary. And at some point, they also bring in the USDOL. And so from that team, the program is designed. The role of the employer is to determine, they typically have to create job descriptions and job titles. So for the RN apprenticeship program, there were positions developed, or a position developed for RN apprentice. And so the employer determines the job title, job description. Then they also determine what the on-the-job training outcomes will be. They identify a mentor. They set the wages. They hire the apprentices. And like I said, they choose the education and training providers and their intermediary for the RTI. Once all of that is done and put on paper, then they request approval by the USDOL. Once that's done, local Michigan Works agency will register that apprenticeship program, and then apprentices can become eligible for state and federal funding that will help support, like I said, the cost of the training as well as support services. So what are the employer wins for an apprenticeship program? Well, one of the big wins is it establishes an early and ongoing employer-apprentice relationship. So, if an employer is working along with an apprentice, both committed to the success of that apprentice, there inherently develops a mutual relationship that, again, fosters motivation, loyalty, and thus retention. So a student or an apprentice who is pursuing a nursing program is obviously not only has intrinsic motivation and extrinsic motivation. They don't want to let their family and friends down. They don't want to let their teachers down. But now, as an apprentice, they don't want to let their employer down because their employer is supporting them through this. So when you start building those early relationships like that, retention of that employee is likely the result. It also expedites or can expedite the time for practice-ready new grads. We know that when a nurse graduates and passes the NCLEX exam, that a lot of hospitals, if not most, have some type of a residency program or extensive onboarding, or some of them can be a year, even up to a year. But if the on-the-job training outcomes are written in such a way that all the outcomes of an onboarding or residency program can be met through the on-the-job training, then it makes that new nurse graduate much quicker ready for practice than somebody that's hired after they finish the program and have passed the NCLEX and are new to a hospital. It also taps full-time employed populations that cannot sacrifice full-time wages and benefits to pursue advancement in a health career. Couple of examples on that, and then also a caveat. I already gave the example of somebody who maybe went through college, got a bunch of debt, but chose a degree pathway that there wasn't a lot of job opportunities after they graduated with their bachelor's degree. And so they're working jobs outside of their field. And they realize that maybe their decision, their degree choice wasn't such a great one, but now they're stuck because they got debt to pay off. They, have rent to pay. They've got a vehicle to maintain. All of those kind of things. And so to pursue another program is out of reach for them. They can't give up their job and their health care benefits to go pursue another degree and take on more debt and work part-time at best to pursue a degree for nursing. And so there are a lot of those people out there. I know a few in my family. And so apprenticeship helps to capture those kinds of people who would be good nurses and gives them the opportunity. I actually have a niece who did that exact thing, only luckily she had the support of her parents and grandparents that allowed her then to pursue nursing after she made a choice of a degree where she couldn't find a job. They redirected her and she was able to go through a nursing program. She has her BSN, is working on her MSN, and she works in the ER at University of Michigan. So there are people who would be good nurses and would like to be nurses that again, their choices were not all that great. The other group of people that I have had personal experience with are the incumbent workers. I received a call from a nurse aide at one of our large health systems who had read about apprenticeships in medical assistant. And she called me because she is a nurse aide, has been a nurse aide with this health system for 15 years. She is a single mom and she saw the MA apprenticeship, but she told me if I were to take part in that program, it would be a lateral move for me from 15 years nurse aide to medical assistant. Can't you develop a apprenticeship in LPN? And I said, we're working on it. We're working on an apprenticeship in RN. I also spoke with a surgical technologist in the same situation. So this is a way to advance exemplary incumbent workers through the apprenticeship model because they can't give up their wages and benefits to pursue a nursing program. Now, the caveat to all this is if employers really want to tap into these populations where nursing education is out of reach because these people are full-time workers with benefits, then the investment that employers will need to make is to pay these people full-time wages and benefits for that time they're in a program, giving them release time, so to speak, to participate in their educational activities. I know of healthcare apprenticeships because there has been, I describe it as dabbling in healthcare apprenticeships around the state of Michigan. And I do know that there are employers that are paying full-time wages and benefits at an apprenticeship wage for their apprentices, and their apprentices are on the job for 3 days a week, and then they give them the 2 days a week that those apprentices need to be in the classroom, lab, or clinical setting as part of the RTI or educational program. So because you won't tap into those full-time workers if you can't replace their full-time wages and benefits. For instance, there may be some great somebody that wants to be a nurse but is working at Starbucks making a decent wage and getting benefits, and to attract them to an apprenticeship where they're only going to get part-time wages and maybe no health care. They as badly as they may want to do that, they aren't going to be able to necessarily afford to do that. So again, that's the caveat to tapping into that full-time worker population. As far as promotes workforce diversity, again, a lot of our diversity is found in our entry-level healthcare jobs. And like I said, those people, not just diversity, not just the diverse population, but a lot of our workers in those lower wage jobs tend to get in those jobs, and then how can they advance themselves if they want to into nursing? Because again, they can't give up their full-time wages and benefits. So it's another way by supporting those incumbent workers. It's another way to advance diversity. There is an apprenticeship program in the state of Michigan that it was launched, I believe, either in the summer or in the fall for surgical technologists. I believe there are 3 employers involved in this collaborative surge tech um, apprenticeship program, and 70% of the students enrolled in that program are people of color. So it can be used, the apprenticeship model can be used to advance diversity. It also can provide a steady talent flow. So an employer may set up a registered apprenticeship program, and maybe they want to hire 6 RN apprentices right off the bat. And maybe the next year they're going to do 6, and the next year they're going to do 6. But maybe they decide to not hire any the following year. That's okay. Or maybe they have a huge retirement surge and they need to do 12. So a registered apprenticeship can expand and contract based on workforce need, providing that steady talent flow for the employer. So what's in it for the apprentice? Well, again, just like for the employer, it establishes that early and ongoing relationship with the employer that fosters motivation, loyalty, and retention. It is an opportunity to work in the occupation, earning wages and benefits while attending school. Many, many, many years ago, I was in a radiography program, and I had a couple of classmates who were working at the hospital. They were working in the radiology department, and that was their job. And they worked as one of them worked in the file room, another one worked at the reception desk. But we were jealous of them because we wished we could do our part-time job at the hospital too. But they were employees of that hospital, and they worked part-time in the radiology department and went through the x-ray program. So the rest of us found part-time jobs elsewhere. So it's a great opportunity for apprentices to be able to work in the occupation with their employer that they plan on staying with while they're attending school. Also, apprenticeship wins. I talked about the LPN for incumbent worker apprenticeship. I mean, if we can pull off these career pathways through apprenticeship, what it will do is attract more students to entry-level jobs such as CNA and MA, because they know that if and when they want to there is opportunity for them to advance to LPN, LPN to RN, RN to MSN, and so on. And so that's another win for the apprenticeship. Also, USDOL, as I stated, comes with quite a bit of funding for the apprentice. So there's federal financial aid, grants, and loans. As I mentioned, the Michigan New Jobs Training Program, that is not specific to apprenticeships, but there is a lot of funding that also goes through Michigan Works agencies that are directed to the apprentice for tuition fees, wraparound services, childcare, oh geez, a whole slew of different things to help the apprentice be successful. So it alleviates debt, frankly, because of all the funding sources available to students in apprenticeships. So I'm going to talk a little bit about the Corewell Health Ludington Hospital story. Corewell Health Ludington Hospital, fairly rural hospital. Actually, I'll back up a little bit. Shelley Bose, who is the Health Science Dean and Nursing Program Director, contacted me well over a year ago and asked me if I would meet with her and her employer, which was at the time was Spectrum Health Ludington, to so that they could better understand apprenticeship and how that might be a strategy for Ludington Hospital to attract nursing RNs. And so I did. I met with a whole group and we talked about it, and several months went by, and then I received an email from Malia Mariani, who's the chief nursing officer, which is now Corewell Health Ludington Hospital. Again, Spectrum, as you know, Spectrum and Beaumont merged, and now it's Corewell Health. And so it's Corewell Health Ludington Hospital. And so Malia contacted me, and we chatted again about apprenticeship and what it really meant. We decided to set up another meeting, and so I brought Shelley and Wendy Wells, both from West Shore. Wendy is on the workforce development apprenticeship side of West Shore. And then also I knew that they would need intermediary. They would need their Michigan Works agency. So I did a cold call to their Michigan Works agency, which is Michigan Works West Central, and involved them. And so the entire team that brought this to fruition, again, the employer was Corewell Health Ludington Hospital, specifically Malia Mariani, the chief nursing officer. And remember, I said the other key partner in an apprenticeship is the USDOL. So we brought Steve Long from the USDOL in, and Malia and Steve were the ones that signed, along with Russ Davis, the RN Registered Apprenticeship Program, and that was signed on November 3rd. Now, the ancillary partners that are part of this are Shelley and Wendy and Scott Ward, who is the West Shore Community College president, and then Shelley Keene from Michigan Works West Central, Julie Sanders from Michigan Works West Central, and then WIN. Myself, but we've also brought some other WIN members into to the partnership, which I'll explain in a minute. So we went back and forth about how to write up their apprenticeship. And at first they thought they wanted to focus on incumbent workers and advance their nurse aides, medical assistants, and so on. But then they decided, no, as long as this is new to us, let's do it easier first. And so what we did was we wrote their program. Corewell Health developed RN apprenticeship positions. They are going to advertise those RN apprenticeship positions to the students that are just starting into West Shores nursing program. Uh, Corewell will interview the students that show interest in this apprenticeship, and they will decide who they want to hire out of West Shores entry nursing students. And those will be the students that then will go through the on-the-job training, but also through the West Shore nursing program. They're doing this to start with, but their goal then is to engage other strategies, such as advancing their incumbent workers. Their goal, Malia has said this over and over, their goal for doing this is, again, to increase retention through that, building that mutual loyalty and trust and motivation, building that relationship with their employee or apprentice early on, in hopes that that employee, that RN, will be more likely to stay on. But another big motivation is reducing that time to practice. So Malia worked with Shelley to design the on-the-job training outcomes, so that by the time that nursing student / RN apprentice graduates, takes the NCLEX exam, that person will be more ready to practice than somebody that has not gone through their OJT. So that is the big motivation for them. One of the things that is important to remember is I just explained what Corewell Health Ludington chose to do, but there are so many other models of an apprenticeship program that could be. So because this is Corewell Health that was developed, those standards, as I described for Corewell Health, can be replicated by any Corewell Health facility, or frankly, by any other healthcare employer. So that can be modeled, but there are other models too. For instance, a whole health system may want to develop their registered apprenticeship program to be consistent throughout the health system. So it could be done for an entire system. It could be done in pathways, as I described, from nurse aide to LPN, LPN to RN, RN to BSN, and so on and so forth. I also want to talk a little bit about a program that I'm aware of. It's in New Jersey, and I've thought it was very interesting, and it's something that could be replicated here in Michigan. But what it is a health system, a large health system in New Jersey, partnered with a community college, and they together collaboratively, they developed their RN, associate degree in nursing, RN courses to be online. So now they have the traditional face-to-face courses, but they also have an online version of those same courses. So in other words, their outcomes didn't change, their rigor didn't change, none of that changed. The admission criteria to get into their program didn't change, but now they have two tracks. They have one that's the traditional face-to-face, they have one that's online. Then what they did was that this health system identified incumbent workers that would go through the online version. Again, these incumbent workers have to meet all the requirements to get into that nursing program that any other student has to meet. Once they are accepted in the program, then they go through any of the required face-to-face part of that online program 1 day a week. So in this particular program, students do all clinical education, lab simulation, and any proctored testing on Wednesday, and that Wednesday is 7 a to 7 p, and it's scheduled at the health system. All the rest of the education, the nursing courses are online. Also, the community college hired, I don't know, I think it was 3 or 4 faculty that are dedicated to this incumbent worker pathway for this health system. So those faculty, while they're employed by the community college, they work at the health system, um, you know, with the clinical lab simulation and proctor testing, and they also teach the courses, the online courses. So there's dedicated faculty to that pathway. Now, this started in 2006. I've had conversations in the last 2 or 3 years with the dean at the community college and asked, what's the success of this? And she has told me that it's still going strong, that they enroll 30 students into that program for that health system each year, and that those the outcomes of those students are good. Well, because, one, they're incumbent workers, and again, there's that loyalty, trust, and commitment that's built in. So there's all kinds of, interesting, creative, innovative models that can be made into a registered apprenticeship program. I talked about incumbent workers. One of the things that as to why it took Corewell Health Ludington quite a long time to bring their registered apprenticeship program to fruition is, again, it's, apprenticeship is fairly new to the healthcare industry. They had to learn about it, get used to it. They had to bring in their HR people. They had to rally the troops within the organization, so that everybody understood the benefits of it and what the commitment was going to be. And so that all takes time. And it's a process, because remember what I said, USDOL registered apprenticeships are easy. They are, but it's getting everybody to understand them, be on the same page, understand too the benefits of them as a long-term strategy. And even though I talked about, paying full-time wages and benefits, even though an apprenticeship might be in school part of that time that they're earning benefits and wages, if you think about long-term strategy and the savings that might be realized through not having to close certain units or not provide certain services because you don't have the registered nursing staff to accommodate that, or the high cost of travel nurses. I mean, if some of that costs can be alleviated, they're paying an apprenticeship wages so that they can participate and become a nurse. It might be, a strong benefit over the expenses of not being able to provide services, and also high cost of traveling nursing staff. So it is a long-term strategy, but that's what, the employer has to think about all those things when they're engaging in that. So that's why it takes, time is for employers to figure that stuff out. So the next steps, what I'm going to say a little bit about is the Advanced Michigan Center for Apprenticeship Innovation. I told you that WIN was an intermediary. Well, we're actually an apprenticeship hub, quite an extensive apprenticeship hub. We have some experts that have been involved in apprenticeship in the state of Michigan for many years that oversee the Advanced Michigan Center for Apprenticeship Innovation, which we call AMCI, and it's part of WIN. It has expertise as well as no-cost apprenticeship tools and resources. We can help you, and what I mean by help you is we can serve as the intermediary. Better yet, we can help prepare employers or Michigan Works agencies or other entities to be intermediaries. We can help with that. We, like I said, convene partners and any way we can. We had a grant several years ago that helped us to develop that. The ABA grant that I spoke about, that's going to help advance the Center for Apprenticeship Innovation even more. It is a statewide resource for anybody across the state. So calling on us at WIN to help pull your team together, again, of your education providers, your Michigan Works agencies, your USDOL partner, and any other partners that you might need. We can help do that. We can also, if you already have your partners together, just like we did for Corewell Ludington Health, we can kind of serve as facilitators, because that's kind of what I did for Corewell Ludington. So however we can help you, we're more than happy to do that. So that actually concludes my presentation of the RN apprenticeship. At some point, I'm going to have the whole team come to one of our meetings and offer an update of how it's going and what they're doing. But I knew there was a lot of anxiousness to hear about the RN apprenticeship program. And so because I was part of that right along the way, I wanted to include it in today's meeting. So now I'm going to open it up for any kinds of questions or discussions.
Jan, as people maybe try to unmute themselves or think of any questions, we do have some comments in the chat and some questions in the chat. Do you want me to go over those while you answer them, or?
Well, let's see. I just brought them up.
Okay, cool.
So I just got to find out where the first one is.
Yeah, it looks like K's the first one at 11:26 a.m. Trying to think about some of the examples in healthcare. Could an apprenticeship be used to help an LPN move to an RN, or an EMT to a paramedic, or a paramedic to a community paramedic position?
Yes, 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 yes. The opportunity is really endless. So an employer can build an apprenticeship in any way that they want. Keep in mind, though, I do want to say there is another misconception, I guess, that apprenticeship means expedited. That is not true. Regardless of where an apprentice starts out, they have to meet the requirements of the educational program. Those requirements are put in place based on data to ensure that student or apprentice is going to be successful in that educational program. So it will take as long as it takes for a student or apprentice to meet that entry level requirement to get into the program. For instance, at one college I worked, and to get into the nursing program, a student had to have gotten a B- in anatomy and a B- in physiology to be considered for the nursing program. That B- was based on all the data that was collected and analysis that was done over the years. So again, it's going to take an apprentice however long it takes them to meet that requirement and get enrolled into a program and then progress through the program. So yes, an apprenticeship can be built, but it's not necessarily expedited. Apprenticeship could take 2 years, 3 years, 4 years. We know in skilled trades, for instance, an electrical, to be an electrician, it takes 8,000 on the job training hours, and I believe 4 years to become a licensed electrician in Michigan. So just keep that in mind as you're thinking about it. So, okay, so what's another question here?
Lynette just had a great comment about the new WCC Pharmacy Technician Boot Camp that just started up this year. It's exactly like this. The students meet once a week on Saturdays, and Monday through Friday, they are required to complete those online lab simulations, quizzes, and tests. So Great example of that. Thanks for sharing, Lynette. And Stacy said, I love to hear this program in collaboration among the acute care organization and community colleges. It's very similar to what we did here in the area for LPN and RN transition students to Comment Healthcare and Delta College, where we added additional sections of the Delta program taught at Comment by Comment staff. We graduated over 50 additional RNs in 3 years, and this was done in 2006 through 2009. Very cool feedback or example about that as well. Thanks for sharing, Stacy. And then it looks like Kelly has a question about, can you share the WPS for the RN apprenticeships? And is there anyone here from Cornwall on the call that could maybe answer some questions about the program, specifically the OJT components?
Okay, so I do believe I can share the work process schedule, which is a term, another USDOL term, WPS work process schedule. What that is it lists the courses in the West Shore nursing program that a student has to complete. So it lists those courses. Those courses are found in the catalog, so there's nothing private about that. But then it also lists the outcomes that Cornwall Ludington has listed as what those students have or apprentices have to do while they're in on-the-job training. So I believe I can. I'm just going to get Cornwall's final permission to do that. Is there anyone on Cornwall on the call who could answer questions about the program, specifically the OJT components? I don't think there is. Again, here's the thing, if there are employers that really want to look at this really seriously, I can set up a meeting with Malia Mariani, who is the chief nursing officer and who drove this, frankly, for Cornwall Health, to have a conversation, not necessarily a presentation, but just a question and answer. I'm sure she's hugely busy, but I'm sure she'd be really happy to do that. She's very proud, just like we all are. And so I'm sure she'd be happy to do that. And someone said, yes, please. So, okay, I will arrange with Malia to do that. So.
Great.
Yeah,
Jan?
and go ahead.
No, I was just going to say that's all I see in the chat, so go for it.
Okay, so regarding Lynette's comment, one thing I want to say is, yeah, I'm a community college, I was a faculty member. I went through community college radiography program. I was a program director, faculty member, and then a dean. And what I can say is if we really want to serve our employers and make sure that our programs are accessible to all, then yeah, we really have to think about how we design and when and how we deliver our programming. Because Lynette's comments, obviously, when I read that was designed specifically for to meet an employer demand. When those courses are offered, how they're delivered, that was really to make it accessible for the students, apprentices, as well as, meet the employer demand. So I think we have to think differently about, or like that 1 day a week program, they had their traditional program, but then running alongside it, they had that apprenticeship program, same outcome, same program. It was just 2 sections of the same course, one online for that apprenticeship for that health system, and then one for the traditional pathway student. So I think we have to, because I don't think apprenticeship is going away, and it shouldn't, because what a win for employers, what a win for apprentices, what a win for those people who, like I said, I feel like they're stuck in jobs and can't pursue another career because of the situation that they've found themselves in. An apprenticeship allows them to advance. So.
Yeah, and Jan, I just want to mention this year was the 80th 85th year of apprenticeships in America. And through that, the U.S. Department of Labor really put a lot of efforts into just making sure that apprenticeships are here to stay. And they nominated, I think, over 100 apprenticeship ambassadors. And I believe 13 of which are Michigan-based organizations and people on the ground in Michigan building apprenticeships. So they were all invited to the White House to discuss how we are not backing down on apprenticeships. We're charging forward almost in a sense. And
Right.
many of the WIN partners and Lynette's organization is part of the apprenticeship ambassador as well. WIN is. So, I mean, you're exactly right. Like apprenticeship is not going anywhere. Now is the time to get involved and understand it, because the federal government is really pushing it. And so is the state. But yeah, just wanted to mention that.
Yeah, as I said, WIN is a hub, but through the grants that WIN goes for and gets on behalf of our board members, um, I believe, if one of my bosses is on here and I get this wrong, don't hesitate to correct me, but I believe in the recent ABA grant that we got, it's going to fund apprenticeship coordinators for some of our members that don't already have them. So, for instance, the community colleges very often have a very, I would say, committed, engaged apprenticeship coordinator on campus employed by the community college. Michigan Works Agency's the same. They have apprenticeship success coordinators. And then, of course, WIN is serving as a hub with resources and tools and on and on and on for both employers and for intermediaries. So yeah, the federal and state government are really encouraging apprenticeships. And I actually was called to a meeting that is the state of Michigan Labor and Economic Development, Department of Health and Human Services. There's a couple others on there, and we're going to meet after the first of the year, and we're actually specifically looking at funding for employers. As I said, there's a lot of funding to help apprentices, which helps employers too, because in a traditional apprenticeship, the employer not only pays the wages and benefits, they also pay for the education. But because there is so much federal and state money out there now, it usually the employer doesn't have to pay much for the tuition and fees and all of those kinds of things for an apprentice. But we also are exploring this group. We want to explore possible funding sources to help with those wages and benefits of apprentices, to help employers with those wages and benefits, specifically during the time they're in classes. So we are moving forward to even explore that as well. So yeah, and that meeting was not called by me. That meeting was called by the state of Michigan. So that's a good thing.
And Valerie did put in the chat the state of Michigan's apprenticeship webpage, which is great. Lots of resources on there as well. So
yeah, I just thank you for mentioning that. There's a lot of information about the state's investment in apprenticeships. In addition, what's really great, there's a Michigan Registered Apprenticeship dashboard, and that gives you real-time information on registered apprenticeships in Michigan, and you can search that information by area, by occupation, by region, and there's a lot of resources there. And as Jan mentioned, we are working with HHS in terms of identifying possible funding sources to further reduce the cost to employers, especially as Jan has noted, and as we all know, hospitals are not like manufacturers, profit-making institutions, and can certainly benefit from financial support.
So it is noon. I've introduced you to the first RN apprenticeship program in Michigan. This was an introduction. There'll be more to come on this. Like I said, I've already got homework of setting up a conversation with Malia Mariani from Corewell Health. And that, and I guess anybody can come, but really, I'd like to keep it kind of for employers, specifically geared, not that anybody can't come, but geared for employers that want to understand from an employer perspective what they did. So with regard to creating the positions and how they're funding and what the on-the-job training outcomes look like that they created and all that employer stuff, how she got hit her internal stakeholders on board and geared up to do this, all of that kind of stuff. Not that training providers can't come and Michigan Works agencies can't come, but I want to again focus on employer to employer conversation with Malia. So, and again, contact me with any other questions you have or any connections you want, or if you want to set up a meeting with people in your organization to talk about apprenticeship, I'm happy to do that. Just let me know. Otherwise, that brings the meeting to a close for today. Have a great holiday season, and I believe I've sent out the HCA cadence of meeting invites for 2023. So you should have all those on your calendar, and we'll see you next year.
Wonderful. Happy holidays, everyone. Thank you.
Take care. Thanks for everything. Happy holidays.
Sure. Thanks. Bye-bye.